Dear colleagues, I want to share with you one of my last clinical cases. This patient was awake in the night because of pain. On the examination, I found positive percussion, positive bite test, negative palpation, 3-4 millimeter wide pockets, periodontal reason, and cold test more than 20-second overshoot. The final diagnosis was painful irreversible pulpitis, symptomatic apical periodontitis, and question about cracked tooth syndrome. Last time in Israel, because of stress, we see many people with cracked teeth because they clench the tooth, and sometimes I think night bruxism also the reason. And I decided to start with cleaning of the old composite restoration, and I put a metal and blue on the tooth. What you can see now, it's a crack line on distal wall, but please pay attention that we have additional crack on distal lingual cusp. I did additional clinical pictures, and again you can see distal crack, and again you can see crack on distal lingual cusp, and as recommended in literature, we need to eliminate the fracture cusp to prevent unpredictable fracture line that may be beneath the gingiva. And I did it, and after I put metal and blue again, and now you see just distal crack. By the way, it's not a good idea to eliminate the distal crack because you never know what the distance it may be, and you can destroy the tooth. In this point of my treatment, I check the periodontal pocket, no pocket at all, and we know that in this situation, the prognosis is good. And I started my endodontics, and of course, I use a very special approach, okay, non-wedging endodontics. I didn't use stiff instrument. I used the most soft instrument. I use here control memory wire instrument with taper 04. And because the distal canal was very oval, I use also as additional instrumentation SIF system. And in the end, I use passive lateral compaction with gutta percha and epoxy sealer, without spreader and without plugger, not to create wedge effect inside of the canal. In the end, I give my recommendation to prosthodontists not to use post and distal canal, and maybe to see what he can use in this case, maybe core and crown, maybe overlay, or maybe end a crown in this specific case. I think this specific case may be interesting for your practice too. Have a silent day. Bye.